Hey, good afternoon, everyone. 4:30 on a Monday after Christmas, kind of, I don't want to do anything. But Karen Roley's coming in, man. She's going to tell us all about speech therapy, and she's going to talk about some interesting stuff.
All right.
How you doing, Karen?
I am doing well. How are you guys?
Good, thanks.
We survived the holidays. Only got one more to go. We got that New Year's thing, but I don't do anything anyway, so it'll be easy to survive.
Correct.
All right.
Correct.
You're our speech therapist at HSHS. Tell us a little bit what you do. Just some basic things what you do.
Basic, yes. So I'm a speech therapist, and basically we kind of do a very broad scope of practice. We target voice, we target speech, language, memory, cognition, and swallowing. And we do that with adults and pediatrics. And so today I was going to kind of touch base on pediatric feeding disorders and pediatric feeding and swallowing.
All right. With that, how young you go back on if they have feeding disorders and stuff? I don't know much about that.
Yes. So I have seen a baby just born a few hours where they come out, and most babies, they're sucking in utero, but sometimes they're born a little bit early or they were born under distress. So sometimes we can go in as early as just a couple hours and teach the parents how to stimulate their non-nutritive suck, whether it's a finger or a pacifier or bottle or breast. So there's some things that we can do as young as a couple hours old.
That's crazy. I had no idea.
Amazing.
Just right off the bat. Huh?
Yes, definitely. And sometimes it can just be like some babies are tongue-tied. They're born and their tongue just cannot cup around the bottle nipple. And so, we can have an ENT or someone come in and clip that tongue and help just retrain that suck, because again, baby's already sucking in utero, so then you have to reteach them how to suck, when they're born.
Right.
Or sometimes it's just by using different bottles or nipples. There's all different things out there on the markets, and it's very overwhelming to first-time parents.
Oh, man.
Yeah, it's been a long time since I've had to deal with that, but I do know about, having to change out different kinds of nipples on bottles because ones didn't work.
Yes.
She had twins. Did one like one kind, one
yes,
like the other
and
kind?
that was the crazy part.
Yes. And it's marketing. It's not necessarily always the best for the baby, but I mean, you can go in the store and there's so many different types and brands and flows. So that's what we're kind of there for, to kind of help
see what
works. The little ones, what works best with the bottle feeding. But then we also see older kids as well that are maybe picky eaters, that they only eat certain foods. So maybe they only eat, I kind of call it the typical white foods, the crunchy cracker types of foods, and then they don't expand into the fruits and vegetables. So we also,
is it a texture thing?
It can be a texture thing. So I call it the McDonald's effect. So if anywhere you go, there's a McDonald's, and your chicken nugget and your French fry is always going to taste the same. But if you have a kid that has high anxiety or has sensory issues, and then they see something that looks different, they're not for sure how it's going to feel in their mouth.
Okay.
But that's why they like chicken nuggets and fries from McDonald's, because you can always,
what
guaranteed.
You're gonna get.
It's guaranteed. So with our older kids, we kind of go in and we can talk to them about, what does the food look like? What does it smell like? What does it feel like? What does it smell like? Can we kiss it? Can we lick it? Can we nibble on it? Can we hold it in our teeth and spit it out? So it's a very wide scope of practice with the pediatric feeding and swallowing, because it can go from bottles to cups to food textures, colors. I've had a kid that would only eat yellow before.
Oh, is that right?
Only yellow Fruit Loops.
Gotta be yellow.
Yes. So it's interesting.
Did you help them out, I guess?
Yes. So
that's awesome.
Yes. So and it can come, some kids are just if you think about NICU babies, they spend a lot of time in the hospital and things in their nose and in their mouth, and so a lot of times they become scared by people coming out their mouth, and so then they don't want anything in their mouth. So you kind of have to teach them how to trust different foods and textures, and whether it may even just be toys in their mouth first to get to foods.
Because they've had tubes and everything for so
Yes.
long.
Yeah,
Definitely.
It's like, get it all out of my mouth. I can't take it anymore. But they need food, and they need healthy food.
Definitely.
And that's what you're trying to get to them. That's very interesting. I never even thought about going to a speech therapist to get to that area. That's pretty cool.
Yes. Yeah.
How'd you decide to become a speech therapist? Kind of curious.
Well, I did health occupations when I was in high school. So, and then I worked as a CNA at St. Anthony's.
Okay.
And just by doing that, I kind of fell in love with like the stroke patients. And then I decided to eventually go into speech therapy. And then I always thought I would only work with adults, but now I actually work more with kids with the pediatric feeding and
No
swallowing
kidding.
than I
Who
do
knew? Yeah.
adults. Yeah.
And
So
I guess it's a very rewarding job when you're helping kids out.
yes. Gives me a lot of gray hair. So
of course
there's-
it does.
Well,
I always say 2 things you can't make someone do. You can't make someone eat, and you cannot make them talk. But there's
You're
kind
trying.
of we're trying. So
That's awesome.
yeah,
Well, very good.
Very interesting.
So people out there that are listening to this are thinking, yeah, maybe my kid, they don't eat like they should. What's some signs that parents should be looking for on that end of
So
it?
definitely, we always our main concern is, of course, dysphagia, which is difficulty chewing or swallowing. So we always want to make sure that they're not coughing or choking or gagging. Some gagging is normal when they're first starting to learn solids, but if you have a kid that's constantly gagging every time they see food or try a new food or a new texture, or if it's a baby that cannot get off of stage 1 or stage 2 baby foods, then that's something that definitely a parent should be concerned about. They can talk to their physician and get an order and come in and see us, and then we'll kind of do a oral motor evaluation. Is their tongue moving correctly? Can they swallow? Can they move it around in their mouth? Sometimes we have to do a video swallow to make sure their airway's safe. So, but that's definitely the main concern that parents should look for. And then definitely, like for your little babies, are they coughing? Are they choking? Are they very uncoordinated when they're sucking from the bottle? Are they noisy? Are they gulpy? Those are all different signs and symptoms of distress. So, when babies are born, they should just kind of eat, sleep, and poop, and it should be
That's right.
pleasurable. So if a feeding is not pleasurable for whether it's a child or an infant, then that's definitely a red flag to want to talk to your physician.
Very interesting. You got to make sure that you do all 3 of those.
Yes.
Yeah, and that's part of the deal, no doubt. Well,
Yeah.
Karen, this has been a lot of fun. And so if people out there, they got these kids and they don't know, because moms and dads, they don't know, and they need to talk to somebody who does know. How's the best way to get in touch with you? Do they go through their regular doctor and then to you?
Yep, they can go through their primary physician and just get an order or script, and they will send that over to us. We're at the Workman Center, and then they'll set you up with an evaluation, and I always tell people, even if you have questions or concerns that you want to talk to myself or one of the other speech therapists, you can always call out to the rehab at Workman's, and I answer questions all the time. So I'm more than happy to talk to people on the phone to kind of help them with that process too.
Yeah. Get the decision out. Okay, maybe we need to do something.
Yes.
So then they talk to their doctor, and then that doctor talks to you, and off you
Yep.
go and get to a better kid.
Exactly.
Awesome
So,
stuff.
Yeah, you want to be able to eat. Eating is very social. So,
Yes.
and then we need that for brain development. So,
Absolutely. All right. Well, Karen, a pleasure
Thank
to have
you.
you here.
thank you so
Glad
much.
you had a great Christmas, and we will talk to you again sometime, okay?
Yes, thank you so much.
All right, there you go, Ken. Good stuff there.
Really?
Always, we just learn stuff every day
We do.
doing these little interviews with HSHS. It's been pretty cool. All right, back with more fun here on The Drive Home.